Good afternoon. My name is Ahir Abbas and I'm a clinician for the day. Can I confirm your full name and date of birth, please?
Yeah, of course. It's Elizabeth Sims, 1st of January 2002.
Okay. Elizabeth, Beth, how would you like for me
I
to...
prefer Beth, if that's okay.
Sure thing, sure, Beth. And how old are you now, please, Beth?
22.
Lovely. Beth, as I say, my name is Ahir. Nice to meet you.
Thank you.
Thank you. Beth, my understanding is you've come in because you've got some pain in the left knee. Would that be accurate?
Yeah, that's right.
Lovely. What I'd like to do, Beth, is I'd like to just ask you a few questions as to what's happened with the knee and all the information around it. What I will then do is take that information and have a discussion with the rest of my team on the side. We'll then come up with a little bit of a plan as to how to best manage this with a bit of a working diagnosis. Would that be okay with you?
Yeah, that's fine.
Wonderful. So just to reinforce in terms of confidentiality, what we discuss here, aside from ourselves, to remain confidential, except I will disclose it to the rest of my team. Would that be okay?
Yeah, that's fine.
Wonderful. Thank you very much. So without further ado, would you mind just helping me to understand what's happened with the left knee, please?
Yeah, I was dancing and from that I've just got pain on the left side of my knee, on the inside.
On the inside of the knee?
Yeah.
Okay. And I'm just going to now ask you a few questions about this, if that's okay.
Yeah.
So what happened exactly? When did this actually happen to start with?
4 days ago,
Okay.
I'd say,
Okay.
the pain started.
Okay. And what were you doing at the time when it happened?
I was dancing.
Oh wow. Okay.
Yeah. And I feel like it was, as I went to the floor, there was a move and it impacted the knee. I feel like that's where the pain started.
Okay. Okay. Do you mind me asking what kind of dance it is that you do?
It's a mix of styles, so it's intense and high impact and lots of energy, so lots of like full out training.
Wow, I'm impressed. Very nice. So you're 4 days ago, you're dancing. Part of the routine is such that you've come down on the knee and you then develop this pain on the inside of the knee.
Yeah.
I think you suggested there when the knee made contact with the ground.
Yeah, it was. I feel like when the impact happened, I felt a slight twinge, but nothing to make me concerned. And then I got up and as I continued, I didn't stop dancing. Then I continued training, and then by the end of the night, it was like a dull ache. But then from that, since I've been continued training, anytime I jump or have impact on that left knee, it becomes a shooting pain.
Okay.
Yeah.
Okay. And this constant ache that you speak of in the background, does this have a pattern at all in terms of morning, evening, afternoon, where it's worse or better?
Yeah, I'd say morning time is not as bad, but by like night time, after the end of dancing, that's when the pain is the worst. And that like I can really feel it to the point where it's all I can think about. I feel like it's because I've been training all day. It's as if that pain gets worse because of it. As when in the morning I've slept, like I've not done anything on my knee, it's still there, but not as big as nighttime.
I hear you. So the intensity is increasing after a long day of training.
Yeah.
Is that okay? And the sharp sensation that you speak of, I think you mentioned it's mostly on the back of exertion. Are there any particular activities or particular moves through your dance routine that actually make that or bring that?
I'd say jumping, because when I'm landing, it's as if that's when that shooting pain comes. And then anything to do with, like, say if this left knee is coming in contact with the floor, anything like that. When I'm not using the left knee, it's not a shooting pain, it's just a dull ache. It's very much like I said, when I'm like, it comes when I'm doing certain moves.
Certain moves, such as the weight bearing or where there's the impact.
Yeah. And
the shooting sensation that you speak of, is that also confined to this left hand side on the inside?
Yeah, all the pain is just on the inside.
Right. And just to very much clarify, the pain doesn't go up or down the leg?
No.
Any pain in the hip or the lower back?
No.
Any pain around the ankle or the foot?
No.
And it's all confined to this one side?
Yeah.
Okay, that's great. So now, in terms of when you had this sensation, did it bruise at all afterwards? Did you notice a bruise?
A slight bruise. That's why at first, when I did impact the knee, I thought that pain was just going to be bruising and nothing serious. But then as the pain continued, that's when I was like, oh, I'm unsure what this is, because usually with a bruise, especially with me, it's like a light bruise, nothing serious, as this was like bruised by the time I got home, but just on the inside.
I can actually see the discoloration that you speak of. Okay. In terms of a couple of questions around anything that might make it better, anything you've noticed that might make the pain better?
I've been taking ibuprofen, but just as and when I need it. I've not been trying to rely on it too much because I don't want to have a feeling of masking the pain. So it does temporarily help, but then as soon as it feels like it's wearing off, the pain just feels even stronger, I'd say.
Yes, okay. So the ibuprofen that you speak of, it's just ibuprofen you've taken?
Yeah.
Okay, and is this oral or is this a topical?
Oral.
Oral, and I'm assuming therefore you've not seen anybody about this issue in the past, have you not?
No.
So is this ibuprofen you bought over the counter from the pharmacy?
Yeah.
Okay, and how often are you taking this? How many times a day?
I'd say twice a day.
But as and when necessary.
As and when necessary.
Okay.
So I wouldn't try to rely on it, but sometimes by the end of the night I'm having to take it.
I hear. Okay, so in the evenings you definitely.
Yes.
Can I just confirm, just on the use of the ibuprofen, you're not taking it any more than 3 times a day?
No.
And are you taking 1 tablet at a time or 2 whenever you take it?
1 at a time.
Oh, perfect, even better. So that's well and truly within the actual recommendations, which is great. Are you taking this on a full stomach, I hope?
Yes.
Wonderful.
Yeah.
And just to make sure you've no asthma?
Nope.
And any gastric ulcerations?
No.
Any sensitivity in the stomach?
No.
Any kidney impairment?
Nope.
And any blood pressure issues at all?
Nope.
Wonderful. That just wanted to sidetrack and make sure that you're okay with the
That's
medication
fine.
that you're taking. Okay, good. And couple of again in terms of severity. So how severe? So if I was to ask you on a scale of 0 to 10, where 0 is absolutely no pain and 10 is excruciating pain, on a scale of 1 to 10, where would you put this? Say at best, at rest, or otherwise at its worst?
I'd say when it's just that dull ache, I'd call it a 3 or 4.
Okay.
So it's just like a nagging sensation. As when it's at its worst, I'd put it at a 6.
Oh wow. Okay.
Sometimes 7.
Fine. Okay, good. I think I've pretty much got a good idea as to what you mentioned there. Just a couple of questions around the actual knee itself. Have you experienced any locking of the knee?
No.
And any giving way of the knee?
No.
And any swelling of that knee at all?
No.
Okay. And any clicking of the knee at all?
No.
Okay, good, very good. Have you had any recent infections of any sort?
No.
No. And any other symptoms such as heel pain or change to visual changes?
Nope.
Lovely. And the pain is very much confined to this one side?
Yeah, it's all just on the inside.
Okay. Now, what I'm going to do here at this point, Beth, is I'm just going to summarise everything back to you, if that's okay. Yeah. If you'll kindly just confirm or as well as fill in any details that I'm missing, is that okay with you?
Absolutely, that's fine.
So you're 22 years of age, you're a dancer by profession, and what's happened is 4 days ago you were dancing. It's quite a high impact with a mixed routine. You've part of your routine was such that you're coming down as part of the move, and the left knee came into contact with the ground. As it came into contact with the ground, you felt a bit of a twinge on that left hand side on the inside. Since then, you've had a constant dull ache that's worse at night after a long day of training, and that's accompanied periodically by some sharp shooting sensation, all again confined to the inside of the left knee, which doesn't radiate anywhere. And the sharp shooting sensation is transient, it's short-lived, and it only comes on the back of occasions where you're weight bearing or again the knees making contact with the ground. You had a bit of a bruise which is still evident, but there has been no swelling, locking, giving way, or clicking of the knee. In addition to that, you also tell me the severity is 6 out of 10 at its worst and 3 or 4 out of 10 at rest. You've been taking some ibuprofen, albeit on an ad hoc basis, and that gives you some temporary relief, after which the symptoms then recur. Would that be accurate?
Yeah, that's all right.
Grand. Just a couple of questions then around your history. Otherwise, are you fit and well in yourself?
Yeah, absolutely.
Good. Do you take any medications on a regular basis, be it over the counter or multivitamins that you might buy yourself? Or
no.
Anything? Lovely. And in terms of family history, your parents are alive and well?
Yeah.
And do they suffer from any conditions?
Nope.
And just to take a couple of boxes, just to make sure, any heart issues with the heart with your parents?
Nope.
Any strokes?
Nope.
Any rheumatism?
Nope.
Any thyroid issues?
Nope.
Any epilepsy?
Nope.
Any cancer?
No.
Lovely. Good. So I think for the most part of it, you're fit and well yourself, no medical problems or conditions. You're not under investigation by the GP for any other condition either?
No.
Lovely, lovely. We've got the issue at hand, that is, just before I now part ways and go and discuss with the team, can I just ask you, what do you have any ideas as to what might be going on with this knee?
I don't have any ideas, but I am concerned because usually, as you can imagine, it's always like bruises or things like that, but it's that constant pain that's just making me worry a little bit.
Okay.
And it's quite important. I just would like some idea, but I don't have any idea what it could be.
And your concerns, I think you've kind of suggested, because your response, you're concerned that this is, do you have any immediate concerns? As to
Yeah, just because I want to get back to dancing, and I don't want to be out of it for any reason. And I just want to know the seriousness. Is it, something that is really, I've damaged or anything like that, or if it's just that pain. I just would like some help and some to clarify what it is really.
Sure. So I think what you're saying, your concern might be that you're not torn any cartilage or anything like that. Is
absolutely.
That what you're hearing? So it's not something more sinister.
Yeah.
Yes. And what are you expecting from me today?
Just some like a diagnosis and some like recommendation or help, as in, is there anything I can do? Is there anything I can take? Or if it's something that I'll have to, maybe like an x-ray, just some like help and clarification, really.
Sure. Absolutely. I'm not going to promise what, whether or not I can meet some of those expectations, such as any imaging, etc. But I'm sure once I have a conversation, we'll formulate a bit of a plan. Now, just before I go to inform the management plan, can I just confirm, do you have any drug allergies?
No.
So you're okay with all medications?
Yeah.
Good. And do you smoke at all?
No.
And in terms of alcohol intake, do you drink?
No.
Wonderful. Lovely. That's great. Beth, thank you for your time.
Thank you so much.
Like I say, I'll go and have a discussion with the team. We'll come up with a bit of a working hypothesis. I'll come back, I'll examine the knee, and then we'll put in place a plan to best manage the condition moving forward. Is that okay with you?
Perfect. Thank you so much.
Thank you.